Hi guys, welcome back to another episode. Welcome back to my YouTube channel. If you are seeing my face for the very first time, hi, my name is Ayomide. I am a medical laboratory scientist. I film about lifestyle, career, self-development, and every other good stuff. In today's video, as you guys can tell, I'm not here alone. I am here with the most popular scientist. I'm here with Mr. Hamza once again, and we're here to learn from Mr. Hamza. Mr. Hamza wants to teach us once again. In case you are coming across our video for the very first time, we have a lot of videos on this channel already: sex education, female reproductive organ, a lot. So I would advise to check the description box for the links. I'm going to link them in the description box below so you can catch up with us. Okay, so I will allow our guest to introduce himself and also prove and give us a lot of stuff again. So you guys should just grab your pen and jot down and let's learn together.
Okay.
Over to you.
I'm Hamza Mohammed, a medical laboratory scientist. We're talking about infertility. As we know, is one of the major problems we have in the world today. Is infertility. So I'll start by the definition of infertility. So infertility is inability to conceive after a year of sexual intercourse. After a year of unprotected sexual intercourse. So if there is no conception, then we can refer to that as infertility. However, this is classified into two. We have primary infertility and secondary infertility. For the primary infertility is inability to conceive a baby after a year of unprotected sexual intercourse. And we have a lot of causes for this. We are going to discuss that after all. So for secondary infertility is inability to conceive after a previous conception. Inability to have another conception again after a previous conception. So that's secondary infertility. So for the primary infertility, we will try to give definition for it, or we will try to give an explanation for it for the male. So we have various causes of this. So one of it is when there is problem with the testes. Maybe the testes are not functioning well, and we have these sperm cells to be produced in the testes. So if they are not functioning well, definitely we have dysfunction or in the production of the sperm cell, which indirectly will lead to infertility. Because for a female to get pregnant, definitely she needs a sperm cell to join with the egg so that fertilization can occur. So when the sperm cell that is supposed to come from the male is not available, so definitely we are going to have infertility to occur. So that's one. So some other cause is undescended testes. When testes that are supposed to be at the normal location is in the abdomen or some other area, so it can also cause infertility. Then sometimes when we have hormonal imbalance, whereby the follicle stimulating hormone is very low, we have the luteinizing hormone to be low, we have the testosterone too to be low. This is called hypogonadotropic hypogonadism. Maybe we should just keep it low. So but what it just means is that in this kind of patients will have defective sperm cell, because what are supposed to nurture this sperm cell to make them mature, to make them viable for fertilization is not there. There is a reduction in this. So definitely we'll have infertile sperm cell, we have immature sperm cell. So whereby they cannot be able to achieve their aim, which is to fertilize an ovum. So those are the causes, and sometimes this might also be caused by exposure to some radiation. It can also be caused by some drugs that are used that can, in one way or the other, it has damaged the testes. So those are some causes of these male infertility.
Okay.
So which can cause primary infertility. And there are some other tests that are done, which is called the seminal fluid analysis, so which is done in a part of the laboratory where we analyze the sperm cell. There are a lot of tests that are done on it, which also determine the viability of this sperm for fertilization. So, and it also determines the suitability of this sperm for fertilization. So for the female, we have a lot of causes of female infertility. One of it include absence of ovary. In some female, ovary is not present, and as we know that the ovum is being produced by the ovary. So when the ovary is not present, definitely we can't have ovum to be produced. And some other causes is absence of the uterus, which is the womb that is supposed to nurture the fetus till the day of parturition, till the day of delivery. So if the uterus is not there, the pregnancy cannot survive. So when this ovum that is being fertilized by the egg that lead to zygotes are not being nurtured by the uterus, maybe still in the fallopian tube or some other area in the body system, is called ectopic pregnancy. And this type of pregnancy usually later rupture, which can lead to abortion and all. So this is also a cause of infertility. And if you've been following us, in one of our videos, we made mention of an ovulatory cycle in which menstruation is occurring but ovum is not being produced. So in this case too, where menstruation is occurring and ovum is not being produced, ovum that the sperm cells are supposed to fertilize is not there. So definitely we are going to have infertility to come up. So for you to check the state of infertility in the laboratory, we have some tests that are done, which are for female follicle stimulating hormone, luteinizing hormone, we have the estradiol, we have the progesterone, we have the prolactin, and we also have the anti-Mullerian hormone, we also have the beta-HCG, and also for male we have tests like the luteinizing hormone, we have the follicle stimulating hormone, and we also have the testosterone. We also have prolactin. It's also done in male too, because research has shown that if you have hyperprolactinemia, so in people with hyperprolactinemia, we have some other hormone will be indirectly reduced. Hormone like follicle stimulating hormone, luteinizing hormone will be reduced, which will indirectly also affect the testosterone. So when there is hyperprolactinemia, this will be managed. So when this is managed, when it's returned back to normal, the follicle stimulating hormone will also get back to normal, and testosterone will also get back to normal, which will enhance the production of a viable and suitable sperm for fertilization. Thank you.
Thank you very much, Mr. Hamza. So I would like to ask for one question. So commonly people believe that if couples are trying to conceive and they've not been able to conceive, they believe that the problem is coming from the woman. So I think this is like an awareness for people to know that a man can as well be the problem. And it's always advised that people go for like, you know, fertility tests and everything. So now for secondary infertility, what is something that, or a pointer that triggers the secondary infertility in women? Because there was a time I was reading an article and they lay emphasis on it's most likely going to be like maybe complication from the first conception, infection and all that. So I want you to like give us brief explanation about the causes of secondary infertility.
Okay. So like you made mention, we can also it's not for secondary infertility. The woman has already has maybe a previous conception.
Yeah.
So it might not lead to delivery. Sure you get. So one of the causes is what we explained the other time, which is also RHESUS incompatibility. So when this occurs, the baby that is formed, or the fetus that is formed, if what is supposed to be done, the treatment that was supposed to be given is not given, so these antibodies are already produced, we affect the newborn and is going to destroy the newborn, leading to another abortion. Sometimes it's called forced abortion. So it will lead to abortion, and like you also mentioned, it can also be due to infection. It can also be due to some other disease condition like fibroid. Maybe the patient has developed fibroid, so it can also lead to infertility even if the person has conceived before. Or sometimes, some people, due to some has aborted a lot of pregnancy, it would have weakened the uterus. So the removal of the uterus can also lead to secondary infertility because the womb is not there to conceive the baby. So it's also one of the causes of secondary infertility.
Okay, so far there is a previous conception, whether there is miscarriage or abortion, the person have conceived in the past, and then
so
now
if there is no any conception, that's when we refer to it as primary infertility.
Okay, I think we understand better now. So thank you very much for coming on this channel. Thank you for always giving us all these hot takes. So guys, we've come to the end of today's video. If you enjoyed this video, please give it a thumbs up. If you have questions, ask Mr. Hamza. He's going to be answering you guys in the comment section. So drop your comments, drop your opinion, whatever thing that you have to say, let's see it in the comment section. And also share this video with every other person around you. Subscribe to this channel and come back for more so you don't miss out any other content that we're going to be bringing to your screen. Until next time that you're going to be seeing our faces again, stay cool, stay calm, and be happy. Bye guys.